50% of American adults over 65 are living under $30,000 a year in income, and 70% of older Americans are uncomfortable with the idea of moving into a nursing home, while the same percentage will likely end up needing some form of long term care. We are facing a crisis where an already income insecure population is going to need massive amounts of care that we as a country may not be equipped to give. Luckily, one man with decades of expertise in public health has decided to lend a hand. Dr. Harlem Gunness has spent his life helping our government fight infectious diseases and recently launched the Elder Care Project. The Elder Care Project is a documentary and podcast series that helps educate families on what to expect as their family members age. He also interviews experts in the field to help give listeners keen insight into how to make the process smoother. Please welcome to Talking Retirement, Dr. Harlem Gunness. Thank you so much for joining us today, Doctor.
Thank you very much, Ken. It's an absolute pleasure and an honor to be here.
Yeah. So I would love, before we dive into the Elder Care Project, to learn a little bit about you. You have quite the resume, decades primarily fighting infectious diseases. So what is your history in public health? And then how did you start the Elder Care Project?
Yeah, great question. So, I've worked in many capacities in public health. Started off from community-based organizations and worked my way all the way up to state agencies, federal agencies, as well as the military. I would say essentially, the cornerstone of my experience is around helping patients, communities, and populations access healthcare, change behaviors, and ultimately to improve health outcomes. So, some of my, I would say, notable accomplishments would be overseeing the Ebola screening operations at JFK. When you think about that, it's really, assessing behaviors that put people at risk for a disease. Other things I've done is some of the health screening of thousands of immigrants, refugees, and asylees, assessing homeless LGBT young adults and how they access healthcare, increasing COVID vaccination by facilitating the deployment of mobile vaccine units in an area in New York City where they had very low vaccination rates, and producing a documentary on the vaccination to really look at the nuance and seeing patients for who they are, regardless of their belief about the vaccine, and also highlighting some of the medical ingenuity that's required for vaccination. So when you really think of it, right, it's all around accessing healthcare, assessing, the quality of care patients and populations are provided.
And also, I watched some trailer about your documentary. A lot of it was the messaging behind getting this access to care, because even if you can provide access, in many cases, people don't want it. So it's like, how do you meet them where they're at and properly convey what the best way to go forward with their healthcare is, too, correct?
Yes, absolutely. I think there's one thing, part of the initial question that I needed to sort of answer, and what sort of led me to what I'm doing now, which is the Elder Care Project. And as you talk about the documentary, I really know nothing about filmmaking. I do know about public health and healthcare. And I do know I've seen many documentaries in PBS and at local theaters, independent film festivals, and also in the news we see segments, and they have certain shows on the experiences of people as they access healthcare. And when I did the documentary, I never thought that I would win awards, because that was not my intention. My intention was really to capture things, nuances that were missed in the news and in social media and in documentaries. It won 6 awards, and it was being considered to train mid-level military medical professionals. So after that, I wanted to, I did that as a hobby. I raised the funds myself, and I said, if this is the way of art that I need to sort of use as something to as one of my leisures or something that I enjoy doing through art, I'm going to continue doing that. So the inspiration for the elder care project really stemmed from sort of a follow up from that documentary, and I hone in on elder care because of my personal experience. My mother had three strokes and double mastectomy in recent years. My father had a bypass. My grandmother was homebound, needing 24-hour care 7 days a week to have someone live with her. After that experience, and then most recently, a family member of mine was experiencing liver failure, and I had to sort of step up to advocate for that loved one to then get a liver transplant that happened in less than 2.5 weeks.
Whoa.
So tying in my expertise, my knowledge, my Rolodex, I like to say, is knee deep in access to services, resources, to sort of challenge the medical community in a very sort of savvy and sophisticated way where we get sort of the optimal healthcare and the outcome that we want. So after experiencing all that, and as well as my education, my training, my years of experience working at these many different, multifaceted, multi-dimension, agencies and providing this service, I felt this. I have a certain confidence in assessing and facilitating what is required for the patient, for the community, for the population, regardless of the disease at hand or the issue, the social issue. I've been able to then successfully do that, and that's why I figured, for the Elder Care Project, we need to really inform and educate communities of different socioeconomic spectrum, low income, middle income, as well as affluent, because they all have needs, and we could all learn from each other. And that's been my experience throughout my career.
No, it's great to hear. And it's cool to see that you're taking your expertise in one part of the healthcare sector and moving it to a different one, because obviously there are nuances and differences, but you're an expert in your field. You know how to move from one thing to another. The Elder Care Project is awesome in scope. And I think one of the things that it addresses is there is this coming elder care crisis. It might already be here, but we also look at the amount of baby boomers and older people that are going to need long term care who may not want long term care because they don't want to have that conversation. No one really wants to have that conversation. So, what are some of the key pain points in this crisis that you have noticed? Obviously, there's hundreds, but what are some of the biggest things you've taken away as you've started to study this particular issue?
Great question. There are many. It depends on who, the type of elder that we're looking at, the patient demographic. I would start off with. What I would sort of boil it down to, sort of from my experience, just my assessment, tapping into this industry or this community, is issues around health literacy and health communication. What I mean when I say that is when I'm interacting as an advocate between a patient and a provider, I often find that the provider is using terminologies, references that the patient doesn't understand. And the provider is using a language and a vernacular that is at a college level or graduate level. And they have extreme difficulty in boiling that down to a lower than a high school level reading level or ability to communicate at that level. And it, not in only in the actual interaction or discourse between the patient and the provider, but you see it everywhere. You see it in the documentation that is provided to apply for Medicare, where there's a lack and a disconnect of really meeting the patient or the elder where they're at, where it's broken down into simple forms where they can understand it. And in the event that they need references of more sort of, this detail, complex description of it, then, let, provide that information as well or have it accessible. But to answer your question in terms of the crisis, I think really understanding the patient for who they are and communicating that. And then when you look at, let's consider the demographics of what a patient comes with, right? So we're looking at a patient that elder patient with more than likely comorbid conditions, right? Different educational levels, cultural differences, right? We know that we live in a very multicultural setting in the United States. And within these cultures, and I'm not just talking about racial and ethnic culture, they're also Southern culture, Northeastern culture, New England culture, cultures within certain states, if you will, cultures within certain ethnic groups, beliefs, practices, people from different countries. When you look at income differences as well, that really can determine the type of access to healthcare that we can we have, the type of benefits that we are entitled to. When you look at the not just access of resources and services, but the capability and capacity of these services, healthcare services that are provided or that are available to elders in communities. There are issues about urban spaces and rural spaces and the type of services that are available there. When you look at the tech, access to tech world or electronic world or the social media and the internet spaces. Do we have elders that are able to do that, and are they proficient at it, or are they not? Are they, we saw that during COVID, where the first line of drugs were available to those at heightened risk. They were elders. But we also saw that that was a huge failure to then, provide this service, exclusively online, where many failed to even sign up, and they had such extreme difficulty. Internet connectivity in certain neighborhoods is an issue as well. And the last thing I'll say, family dynamics, social support, right? Who we are, how do we interact, our history with our families as elders, or vice versa. Do our families really understand and know the complexity and challenges as we grow older? Do they really understand issues around dementia, and at what point do we then step up to then become the parent to our parents and say, you know what, I don't think that you're able to drive anymore, or you really do need some supervision. So I'll stop there.
No, I mean, those are all great points. It really shows you the scope of how deep this is and how many different factors and pieces come into this conversation for each individual person. Two things he said that really resonated with me are, one, the technological component. A lot of these government agencies or Medicare programs or whatever it may be are trying to force people to do things on the internet. And we have a lot of clients who have no internet access. And on top of that, aren't mobile either. So they're literally stuck at home. And unless someone physically comes to their house, they're unable to access these benefits. So, like you said, it's a huge thing. And I think a big issue we run into is whether it's life insurance when you're 30 or when your parents are aging, no one wants to have these conversations about what happens when your parent no longer can take care of themselves? What happens when they have dementia? What happens when maybe you are maybe you are disabled? And it's so much better to have these conversations before they happen because you have a framework in place, you know what you can do. But like you said, so many people have family dynamics where they don't open up about these things until you're working retroactively because a fall has happened, because someone has dementia, something like that, and it becomes much more complicated.
Yes, and I hear it in almost every. I'm at the age where most of the people I know have, parents who are aging, and very few of them. And I speak to a lot of people. I have. Rarely do I hear them being proactive, either the aging parent or the children, to speak about preparations for end of life, or even preparing to protect our the parents' hard work and earnings and sacrifices they have made all their lives, and to see that being sort of taken away from them due to lack of information, lack of education, lack of understanding what sort of services are available to us as caregivers and to our parents who have worked so hard to preserve their legacy. They lose that. They lose that in making these irrational or uninformed decisions or last minute decisions in an emergency. And that's something that I would really like to see, to at least make a contribution or difference, through podcasts like what you are doing, and the type of work that you're doing to really bring highlight what is available and how can we then protect ourselves, our elders, and what they have worked so hard to establish. I think it's really critical.
Yeah, it's crazy because if you're listening and you don't know what Medicaid is the agency a lot of people have to fall back on in order to get nursing home care. And I'm sure you're familiar with that too. In the process of becoming eligible for Medicaid, you have to spend down all your assets. So a lot of people save six, maybe seven figures throughout their life. And because they didn't have the proper estate planning, all that could be gone in a matter of 2 or 3 years of long term care. It happens very quickly. And if you think you're going to pull a fast one on the government, they're going to look back 5 years and make sure you didn't transfer any assets. So the whole thing is pretty crazy when you look at it. And I think I agree with you that there's such an education gap, not only from the private sector but the public sector. And I kind of want to transition to, you've been involved in public health and public policy your whole life. What are some public policies that you would like to see to help address some of the things we've been talking about?
Um, that's a great question, right? So, when we think about policies, we have to think about who's involved in establishing, in making these policies, in introducing these regulations or these changes, right? So we have to look at policymakers. Who appoints policymakers? Politicians, right? Who influence politicians and policymakers? Influencers, healthcare companies, corporation, pharmaceutical companies, transportation systems as well, federal, state government agencies, right? Then they then sometimes are they're the ones to develop or amend policies, as well as us, the individual, the elders. I think when we think of policies, we have to think about the role we play as caregivers or as elders, um, in the decision making, and be at the table and be present, and be informed and know what's happening. You know, in my in all my interviews, there's something consistent that I'm hearing, and that sort of ties back with the first. Earlier in our discussion when I talked about health literacy and communication, and The issue we're having is that for many elders, they are pigeonholed into deciding in a very short period of time what plan to take once they are eligible for Medicare. Many of them, especially those who are perhaps uneducated or from low income communities or lack services to help them to enroll in Medicare. They don't know how to enroll, how to whether I get my benefits at 62 or should I wait till 65? Oh, I'm healthy. Maybe I should wait till 70. Maybe I'll get more. At that age. So enrollment is an issue, right, with policy. The other issue is the advantage plans. It is so overwhelming to decide what advantage plan should an elderly person choose, or should they just stick with the the sort of the non-advantage plan, if you will. And what I'm hearing is the the regular Medicare plan seems to be much more effective than the Advantage plan, but the Advantage plan is very glamorized, if you will. When we think of policies, we have to think about, do our elders really understand what is available to them? And are the policies affecting them and their decision? When you talk about everything is online, right? It is, and it's wonderful, but it's not wonderful for my mother or for my father or for those who don't really know how to navigate the internet. And it can be very dangerous when you provide all your personal information and not knowing what you're doing, and very overwhelming too, right? And you then make a wrong decision that's going to affect your entire life. Or you change one plan to the next, and then within that plan, there is an interruption of your health care where you did not get a refill for a blood pressure medication. And as a result of that, you suffered a stroke.
Yeah, you were preaching to the choir. This is the stuff we see every single day. And to talk about some of the things you brought up, we're brokers. We have to stay partial. We tend to prefer Medicare supplement plans as opposed to the Advantage plans that you mentioned for a lot of the reasons that you did mention, because original Medicare with the supplement has really, really comprehensive hospital and medical coverage, but the Advantage plans have things like prescription coverage and dental and vision built in, those glamorized things, like you said. It makes a lot of people choose it for that reason, not realizing the trade offs in hospital and medical coverage they might be facing due to that. I remember I went to a client's house and I had their sister sit down too, and she was in an Advantage plan, and she was really trying to push her sister to get an Advantage plan. And I said, okay, you're in an Advantage plan. There's nothing wrong with that. I sell Advantage plans every day. But did you know your out of pocket max is $10,000? And her eyes blew up. She went, I had no idea. I just was looking at dental, vision, over the counter benefits. And it becomes scary because those little decisions, like you said, resonate for decades. It's like that little piece. So I want to pivot a little bit. We are going to be talking about your documentary and podcast series, The Elder Care Project. You have now done 11 episodes. What are some of your favorite episodes, and which episodes have given you the most information about this crisis we face? Like, what are some of your highlights so far?
For each episode, it's unique in its own, in the sense where I get a takeaway lesson or a message from everyone I interview, and something that's new. And I wasn't really expecting that. So I'll give you a great example. So I interviewed a person by the name of Stephen Dansky, who was once a supervisor of mine many years ago. And he talks about loneliness and abandonment to the degree where taking care of his partner and who has a renal failure, and they have to do hemodialysis. and how intense that is for an elderly person to have to go through in their 70s and 80s. And it's just two of them alone that have to face this. And one of the things that really stuck out for me was that when he communicates with friends and family and relatives about the issue, they would send an emoji.
Oh, that hit me in the chest. That's terrible. Oh no.
They would send an emoji. And, when I heard that, it's kind of like unsettling, humbling, and I would hear that cry a lot with elders. And I also, I had an interview with an attorney, and the attorney, one of the things that resonated in my interview with her, Laura Ford, or Laura A. Ford, is dignity and being able to establish dignity, restore dignity, or maintain dignity. And I think that is what's missing. And when you tie in the social media and the digital space, everything we have at our abundance, at our fingertips, access to so much. But we're also seeing more loneliness, depression, misinformation, miseducation, and an emoji. And that lack of connectivity. Yes, so what if they have dementia and they say something 10 times? Understand that you're dealing with someone with a condition, and that's a symptom of their medical condition. An emoji doesn't fix it. A like or a text, it's a phone call, and really understanding who you're talking to and the degree of burden that they are facing either as an elder or a caregiver to an elder. And then also exploring how they are trying to take care of themselves as elders. And one of the things Stephen said was he's really confined because he really can't go out because it's a 7 day, a 5 day a week process. And you're really, it's as if you're sort of, in a jail, if you will. And how do you then find, and he tried, therapy and support groups, and he couldn't find what would fit for him. So he established one himself. And he's also very creative, and he had to find ways within that small room where the hemodialysis is occurring, find ways to express his creativity through his photography, and on the weekends go out for a walk and go out and take pictures or to an event. So really, it requires a lot of work inside for you to really look deep inside, for you to find, some resolution or some way of giving back to yourself without becoming overbearing and overburdening. And then the other thing too I want to say is that we got to really understand how we take care of ourselves. So for me, taking care of myself is, I'll spend the extra money to, if I have it, to get the extended care that I need. Because when I am providing that care myself, then I am devoted to it, right?
Hmm.
Say we can't afford it, then, have friends over. Like for me, I'm a social person. So I would have friends over. Like, I'm home alone this whole week with my kids. You bet every day after school, if they don't have an extracurricular activity, we're going somewhere. We're going
Yeah.
to see something, we're going downtown, we're going for a walk, we're going for ice cream. Or, and if you can't afford the help per se, invite people to come over, right? Or if you can take your aging parent with you, go to people's house. But that emoji doesn't help it.
Yeah, I think something we've talked to with a lot of our clients is they're at the phase where maybe they're in their 60s or 70s and they are taking care of their parents who are in their 80s or 90s. And you don't realize how much physical and mental toll goes into being a caretaker of someone who is housebound and potentially has severe mental issues like dementia and Alzheimer's. And the caregiver ends up degrading too. So I love that you brought up the idea that no matter what's happening, you have to find time for yourself and you have to have a social life and you have to keep yourself tied to the world outside of that house because otherwise things can decline very, very quickly. And it can be pretty scary if you don't have that support system in place.
Yes, yes, absolutely. We saved about $1,000 a month by just going out there and transporting the aides, right? Because they had to switch. We had an aide that would be there for a week, and we had a weekend aide. And just by transporting them, because you get to catch up with them, you get to know who they are, you get to talk to them. That's the other thing I'd like to share. We shouldn't just trust a home health agency to provide the service. Not saying that you can't trust them, but I think if someone is taking care of me or someone who I love, I want to know who that person is, regardless of our socioeconomic status, our racial or cultural difference, or different country they may come from, or different town, or whatnot. I really would like to know who that person is, and I think it helps us to get to really know them, and you really do see a difference in the type of care they provide. I really do believe
They
that.
essentially become a member of your family. They're there
Yes.
all day. So you need to make sure that you're okay with that person being a member of your family.
Yes, and then also too, especially for elders, most elders do not want someone in their house. I don't want anyone in my house. I don't want anyone telling me what to do and how to do it. And you can't take care of things the way I would take care of things. And I'm not ready for that. And nope, I can, I'm responsible and I can handle it, and I can handle it until you end up on the floor with no help. Oh, I don't want the emergency life alert. Or the you get the watch, the iPhone watch, but they don't wear it,
Hmm.
right? And the iPhone watch don't really pick up on falls, because it depends on the sensitivity and specificity of the watch, and you may fall and not feel it. So you
Hmm.
would not get that alert. I'm not sorry, it would not recognize it, so you don't get that. So all these things we have to sort of, but I think really understanding and working with the aid that you have, whether it's through Medicaid or through your insurance program or through private duty, know who they are. That helped me get one of the best aides that I've ever met in my life. And my career started off as a nurse's aide.
Yeah.
So I know what that culture is like, getting underpaid, having to work very long hours, being they have lives too, and they're stressed out as well. So
Hmm.
really, trying to understand who they are, and if you could be a support to them, cook a meal, whatever it is, to support them as well, because they are ultimately helping you take care of your parent.
Yeah, which is very important. And I want to hit on something you mentioned. You talk about people saying, I don't need help, I don't need this, that kind of thing. I think we find with our clients, there's a lot of pride. And that can sometimes be a negative thing, like the things you mentioned. But I find in a lot of ways, it's a very positive resilience because we have clients that are on the very low end of the income spectrum, and we're doing everything we can to help them out, and the appreciation these people show with the little that they have is unbelievable. They'll buy you boxes of chocolates, bottles of wine, whatever it may be, and they're always saying, even if I need your help, it's going to be reciprocated. And I think we have to take that into account, that no matter if you're 34 like me or 84, no one wants to feel like people have to take care of them, I don't think. And I think we have to keep that in a perspective, that a lot of these people are losing their agency. They don't want to lose their agency. And a lot of that comes into, how do we help these people while making them not feel like they're a burden, and just saying, hey, this is part of life. It's going to be okay. And we're going to help you. And you're still going to make the decisions you need to make.
Yes, that's a very, very that's a excellent point. So, from my experience, there's a very fine line. Like you said, we want to protect our agency. We want to keep it. We want to keep our independence. All our lives, we've been raised to be independent, right? And be responsible. And all our lives, we have been, for the most part, right?
Yeah.
Until we start getting older. There's a book. I know I'm going to be aging myself here, but it's a book called Tuesdays with Maury. Are you familiar with the book?
I'm not. I'm going to write it down and look into it, though. So I'm putting it right here.
And
What is Tuesdays with Maury?
and Tuesday with Maury is about surrendering. It's about someone with a terminal disease surrendering and preparing ourselves, our bodies, our mind, our hearts, our spirits, in surrendering with what's ahead. And I think I go back to that fine line, and I only find that to be really productive and healthy if there is that communication, right? I talked about communication at the beginning of our conversation, and that communication with me and the aging parent, communication with the doctors, being on top of their care, being on top of the type of care that they receive, being on top of the type of assessment that they're getting, right? And knowing who they are and advocating for them. So, oh, so you did this test. So what did the test say? And okay, and what about a mental health? So you had a stroke, and you had 3 strokes, and no one thought about doing a mental health evaluation. No one. No one ever. No one talked about this.
Yeah. Crazy.
Yeah. So, and you had 3 strokes, and we do know that it affects your brain. So, how do you feel about, simple things like, how do you feel about experiencing this? You
Yeah.
know, if they're able to talk, if they're able to communicate, right? And also understanding what is available to you. A lot of families don't know what's available to them. So going back to your question about interviews I've had, I interviewed a CEO of a home health agency, and I learned so much about what's available through our employee assistance programs. If you have if you were a veteran, long-term care insurance, health insurance, what's available to them. Um,
Hmm.
yeah.
I know what you mean. We have an amazing adult daycare next to us, and we got to talk to the CEO of that location, and he said a lot of people don't know that if you're on Medicaid, we'll pick you up. We'll literally send a bus to your house, and you can hang here all day. Then you can go back to your home. And it's so hard to sort through all the red tape and the bureaucratic tape within these government programs and these insurance programs, that so many people can't access what they have a right to. They don't know it exists. And then you can blow people's minds. There's a lot of state assistance programs here in New Jersey that help pay for drugs and help pay for utilities. And people are completely in the dark about the fact that they can get them. So I agree with you. There's such an education gap. I think partially because a lot of people maybe might not find this stuff super interesting like we do, but it's also one of those things where if you can bridge that education gap, I think everybody's going to be much better off.
Yes, yes, absolutely. On my website, eldercareproject.com, has a list of resources in New Jersey and in New York to help elders. And I would love to, on a different note, chat with that CEO of the adult care program. One of the things I did discover today was Atlantic Healthcare System has a very exhaustive list of resources, elder care resources, and not specific to their system per se. It's outside of the system as well, which I thought was very impressive.
Oh yeah.
Um, yeah, yeah, and you know, the complexity of this to sort of wrap our heads around, right? I think the more we're doing it, and the more we put ourselves out there, um, the more it's going to help the community, elders, caregivers, and to sort of improve the quality of life and give them that dignity that they deserve.
Mm-hmm.
You know, put aside issues of business and marketing and advertisement and funding and all that stuff, but just to have the ability to provide this service, I think to them. And in what you do is that it's to benefit them. It's to really
Mm-hmm.
improve their lives, improve their health outcomes, and also improve their, even their kids. That the family caregivers as well, so that they are more informed and knowledgeable about what's out there. Like we talked about Medicaid spin down. That's real,
Mm-hmm.
and people they don't. I mean, I can't speak for anyone else, but for me, I don't want the the funds or the legacy for myself. But it would be great if they would like to leave an inheritance for their grandkids,
Mm-hmm.
whatever that may be,
Yeah.
you know. And if we can protect that and preserve that, then I think that that's very empowering.
Yeah, I mean, generational wealth is something that really helps elevate people and, keep people going for generations. It gives people a huge leg up. And when you lose that ladder, it can send ramifications through generations, as I'm sure you've, studied and everything within public health. Dr. Gunness, this is all amazing information. Your perspective is awesome. I'd love to know with the Elder Care Project, what your goals are in going forward now that you've gotten a couple podcasts under your belt. Like, who do you want to get on? What other topics would you like to tackle with that?
Yes, great question. So, we talk about the complexity of the issue. We talked about the multifaceted factors that affects it, how the multidimensional levels of the approach. So this is vast and wide. So, I would like to get folks who I would like to get an executor, someone who's going through the process and hear about the growing pains. I'd like to talk to some more leaders in the industry. You mentioned the adult care program. That's one. Research in dementia, Alzheimer's. Those who are providing services to that population as well. I'd like to talk to social workers and psychiatrists, the medical industry and specialty within that care. So that, it's sort of, again, it's based on my experience, right? So it's from the ground up, as from the patient all the way to the policymakers, right? And those who can be influential and sort of make a decision. I would also like to talk to someone from Medicare and Medicaid, hospital social workers to see or nursing home social workers to see what their take is and what their experiences are.
Yeah, it's crazy how you listed, 10 new subjects we could dive into, and that only scratches the surface of just how deep this industry, problem, crisis, whatever you want to call it is. It's amazing how many people go into this. And I'm very happy that you are now one of them because you have a lot of expertise. You have a very positive outlook on how to fix things. And I'm very grateful that you've lent yourself to this industry to help us all get through it, help people guide, and hopefully get people relief in the process.
Thank you, thank you. I really appreciate it. I appreciate your time, and I'm looking forward to learning so much more about
Yeah.
what you all are doing and collaborating.
Yeah, absolutely. So, real quick for the listeners and people watching, I will link everything, but where can people find you, Dr. Gunness, if they want to follow the Elder Care Project and everything else you're doing?
Okay, so the website is called Elder Care Project, all one word, all put together, .com. So eldercareproject.com. You can find information. You can find links to the podcast, and also learn about. So the podcast is a way for me to sort of screen and assess what how then we should then create the documentary, right?
Okay.
Because I want it to be sort of something that sort of is it's different from what's out there, and that we can sort of understand, to really capture the nuance of the experience of elder care. And that's why I'm interviewing. That's one of the reasons why, but also just for the knowledge base as well. So yes, eldercareproject.com.
Awesome. Well, Dr. Gunness, thank you again for everything. I will link all the information below. And if anyone reaches out to you, definitely check out the Elder Care Project. A bunch of great information. So, once again, thank you for your time, and we'll be in touch soon. Thank you.
Thank you, Ken. Have a great day.